don't
I'm
know.
going to do the recording so that way I don't forget. I don't want to miss any of this.
Yeah, we've got about like maybe one more minute and then we'll start.
Okay.
Hi, Leanna. Can't hear you. You're muted.
All right, well, we'll go ahead and get started. Hello, my name is Nikki McCutchen. I'm one of your co-hosts tonight, along with Vicki Malad. Dr. Caroline is not going to be able to join us this evening, but we are so excited that you are here and know that someone really cares about you to want you to know about this technology and invite you to the call tonight. The call tonight will be for 30 minutes. We are going to be talking about the X39 stem cell activation patch, along with having my beautiful friend Sandy tell us her experience with the patches. And we want to just get started with our medical disclaimer. The information we'll be sharing is for your informational purposes only. If you have any medical conditions, please check with your physician or healthcare practitioner. All LifeWave patches are not intended to treat, cure, diagnose, or prevent any disease. If you are on medications or have medical conditions or are pregnant or nursing, please check with your physician first. So now I'm so excited for Sandy to tell you all her story and her experience with the patches. So just tell us how you heard about the patches and what your experience has been with them.
Sure. I think maybe there's a story in the Bible about a woman who suffered much at the hands of physicians. I could be one of those women. And I've had a lot of medical problems in the last 13 years. I received an IV of a medication, and within 12 hours, I had severe, excruciating, like someone was hitting me with a baseball bat up and down my spine. And after that time, I had not a hip replacement, but an entire hip reconstruction. I had a parathyroid surgery. I had 4 back surgeries, metal screws placed in my back, and then having to be removed. So my daughter, Joy, who is now 25, worked at a clinic where they stretched people. And her boss had just had gallbladder surgery and was talking to me about stem cell therapy. Well, a friend of mine had just had hip stem cells for almost $10,000. And I said, I don't have that kind of money. And she says, oh, no. This is a technology. Nothing goes into your body. It uses your light in your body. And what do you have to lose? You can just try it. Because my surgeon said he'd never seen anyone's scar heal up this fast from gallbladder surgery. So this was in May. I started with Eon and X39 for 3 months faithfully. And I was told, your stem cells know what your body needs better than you. So I was not seeing any relief in my migraines. I wasn't seeing any relief in my back pain, but every day faithfully I used them. Kind of ran out of money, so I couldn't reorder. I had a medical procedure at the end of July, and my dear sweet Frances encouraged me to use all the patches and to use them right away before surgery and after surgery. And I don't know if you've ever had someone burn your nerves, but I'd had it done 4 different times and it's excruciating. I don't even know if someone were to cut off the ends of your fingers and put fire on there and then for 6 weeks say it'll get better. It would get better and keep me out of a wheelchair for about 4 months. And then I would have to do it again. So that was July 27th, and I didn't quite have all the patches. So I take a very strong medication called Norco. It's an opioid. When I have these procedures, it's a 10 out of 10 or 15 out of 10. The pain is just excruciating. I would have to take at least 3 a day for a minimum of 5 weeks. So that's 111 pills. And by God's grace, I did not get addicted. So this time, the patches hadn't come in, and I was on the 4th day. And I tried really hard. I'd only taken 4 of the narcotic pills. So I keep a journal. I keep a journal of all my medications and a journal of the patches. And I said here, August 2nd, the patches came, exclamation point. I put the Eon on my back. I got some relief. I was a 9 out of 10. It went down a few points. 11:30, I tried the ice wave on the acupressure points of K27 and K1. That was supposed to help with all over pain, and it did. The pain went down surprisingly to a 6 out of 10, and you have to understand, for 13 years, I never had a 6 out of 10, ever. Even with all of those medications, 6 out of 10 was, I couldn't even tell you. I mean, I was like ecstatic. In the middle of the night, 2 a.m., I thought, what if I try this ice wave on my low lumbar back? So I tried it. I drank 24 ounces of water. The pain dropped to a 4 out of 10. Happy face. This is by 3 a.m., the pain in my low back was a 2 out of 10. It had never been this low in 13 years. This was just the beginning, friends. I haven't had a Norco since that time. I have been using many combinations of the patches, placing them on the advisement of the acupuncture locations to detox my body. I take over 15 medications a day. Used to be 17, I'm down to 15. I'm hoping for less. I'm sitting up. Most of you see me laying down every day. I haven't sat up in a month. The last few days I've been able to sit up for 2 or 3 hours, not straight, but a little bit at a time. The last 4 days, I was able to walk for 20 minutes in my neighborhood. I haven't done anything like that in more than 4 months. Unless you have been a person who has forced to become a shut-in, not see people, not go to church, not be able to drive. I didn't even tell you about the last 2.5 months with my blood pressure going to 180 over 110 and then dropping to 60 over 45 and almost passing out. All the MRIs, all the heart tests. That's a story for another day. Today, I just want to share that because of my daughter Joy, because of wonderful people that I have met to share what the patches are, how to use them, where to place them. And I have tried to listen to the Zooms and learn what I can. I am improving every day. I tried all of the medical procedures. I tried the surgeries. I've tried the medications. I've tried acupuncture. I've tried chiropractors. I've eaten healthy. My background is I'm a dietitian. I've taken care of myself to the best of my ability, but it wasn't enough. I'm just really grateful. I won't ever not use these patches because they don't do any harm. They only reflect the light that's already in you. And Nikki reminded me, God is light, and if it's reflecting light, it can only be good. And I'm just excited to see what happens in the next 5 months. This has only been 5 months. And I'm probably forgetting things, so you can ask me questions, but that's
Sandy, we are just
the overview.
We're so excited for you and just rejoicing in the Lord with you for what he's doing and how he's using the patches in your life. And I think your story is so important because I think it's so easy for people that, especially when they've come from backgrounds like you with so many surgeries and so much pain for so many years, to give up so, easily within a month or two. And, for you to just stick with it, it just needs to be applauded. And I'm so proud of you for sticking with it and so thankful that you've had the pain relief that you've had. And again, I know there's so many other things that restoration that you still need in your body. And we are looking forward to the day that we get to rejoice with you. That those things get restored as well. And so I want to make sure. So I think you had told me, I don't know if you said it tonight, but you would have taken by today, if you would, because you still would have been on that drug, and you would have taken 150 pills by today. I think that's what you told me yesterday. So you'd only taken 4. And every other time you've had these surgeries, you would have already taken 150. So like that is mind blowing to me, to go from normally after these surgeries, 150 pills to only have having 4. Like that's a miracle in and of itself. And I know you have so many other things that you're still looking forward to, but I'm so thankful that you just haven't given up and that you're going to keep doing it, and you're seeing the results, especially with still being in pain. I think sometimes people, just it can so make you have brain fog and just feel bad and not have joy. And you are full of joy and full of life. And I am so glad to count you as my friend. Anyway, all of that, I'm not going to cry with Sandy. I'm going to hold it. But we are talking about stem cell patch. She told you of some of the other patches as well, but this one is X39. And what it does is it works through a process called photobiomodulation, which is a big word for just light therapy. And it's very similar to the way that when we go out into the sun, our body then creates vitamin D because of that light reactivity in our bodies from the sun. You don't need the sun when you're wearing these patches because we actually have our own light and the own heat that's created in our body. And so these patches, the way that they're created through a crystal lattice structure, then reflects the light back into your body to activate the GHKCU, which is the copper peptide in our body that activates and mobilizes that copper peptide to tell those stem cells to get up and get going. So then your body decides the way God designed you. Your body gets to decide where it needs to go first, where those stem cells need to go first. So if they decide to go to your liver, that's something you may not necessarily feel it working on areas like that, or your immune system. You may not really feel that. For some of us, it could be pain. But like with you, Sandy, you know, it's taken several months for you to start to get even some of that pain relief because it was probably working in other areas that you needed. So the great thing is that it always works. This is what it's designed to do, is reflect that light to get that going, even if you don't feel it right away. And I love that about it. And when you stick with it, you will eventually see results. And so that's one of the things I love about your story. So what would
There
you
is
like?
one other thing I wanted to say, and that is, I feel very strongly to share this, that I have a moral obligation to share this with people. It would be like if I was locked up in my home with a bunch of other people in pain or in agony or couldn't move, and I had the key and I could go outside and there was freedom, but the door was locked for them and I knew how to get out and I didn't share it with them. I want people to know that this is an option that is only good and it can only help. So I'm very motivated to let people know not just what it's done for me and not just what you can see, but what you can't see. Things, you know, for your heart, for your liver, for your lungs, for your circulation. And I didn't want to forget to say that, how important I feel like it is to share it, because it only always helps. It may not help how you want it to, when you want it to, but it is working. And I wanted to make sure that you knew that people knew that. So thank you,
Yes.
Nikki.
Yes, thank you so much. Vicki, what would you like to add, and what questions, if y'all have questions, Vicki and I can hopefully answer them. And if we can't, we will be sure to get to someone who we can get the question answered for you. So what do you have for us, Vicki?
Sandy, I wanted to ask because I wasn't sure if you had said that when you were speaking. How long has it been since you've been using the patches for?
5 months. I
5 months.
started in May.
Okay.
And I only, for 3 months, I only had Eon and X39. Then I went to a diamond, so I got the full variety of patches so that I could use a more overall approach to cover different techniques with the different patches for the last 2 months.
So you have been experiencing continual use with the X39, which is amazing because I really wanted to touch base on that. When we are using this stem cell patch, you know, sometimes our expectation is unrealistic, you know, and that's kind of like our job, knowing that this technology works with your body. Now, someone that has underlying health issues, you're looking at somebody, the stem cell patch is not going to clear or help your body right away. Possibly everyone is different. For me, I didn't feel the difference, probably like I couldn't really notice it for months for myself using the X39. But I just wanted to say that over time, the benefits get better and better. So the continual use of X39 every day is amazing because our expectation sometimes is unrealistic. And the reason why I say that is because when you're in pain or you have a health crisis or a health challenge, you want it to be fixed right away. And sometimes that's what I struggled with anyway, because I was like, I got to do this and I got to do, and you're trusting these doctors to help you. And I can relate in your journey here, Sandy, because it's very frustrating. When you go to the doctors and sometimes they say there's really nothing we can do for you, you know, and you're trying your best and you're every day you get up and you fight and you know, you're doing the best that you can. And for me, I was just like, well, I wasn't accepting that I needed to have a little interstem in my back for my bladder. And I was like, no, there's no other options they're giving me. So I have to go out and figure out what I can do on my own. And thank God that the Lord brought this to us. And, you know, my husband was the first one to use the technology with Brother Lorenzo. But I just want to say I'm thankful for this because it was definitely a godsend for me as well. And the continual use of just continually wearing this patches. I mean, there were so many micro changes in my body. I didn't even realize it until after the fact, and it's just mind blowing. The more and more that you wear this on a daily basis, you figure out your patching for you. I have a different patching for myself. You just keep wearing it and just continually use it, because your benefits are going to get greater and greater. And remember, it's not anti-aging, it's age reversing. So I'm just thankful that you shared this with us. And if there's anything that we can do to help you, please reach out to us.
I just want to say that the team is phenomenal. And I think the support is really important, because when people are explaining to stick with it and your body is wise enough to know what needs work, and it gives you a lot of encouragement, because if you're just trying to do it by yourself, you don't know those things. And we have this beautiful experience of all the people that have gone before us and have the benefit over 20 years of using this technology, and we can learn from that. And I would have to say that has made all the difference for me, in as far as really just being calm about it'll work. I'm just going to stick with it. I mean, the person who signed me up says, well, you really need to commit at least 6 months. And I says, not a problem. I'll do it for a year. I know that you have to stick with it. So I think the organization and the support is really important, to let people know that they mean it when they say it. They're here for you. These people are really here for you. And it has not only affected my health, but I've developed some wonderful friends that I think I'll have for life. And it just means the world to me.
Amen. I wanted to touch base on that also, because as far as the technology goes, the way that you were introduced to it, you're going through a struggle and a trial, and you're thinking, oh, I have to go to the doctors, I have to have this test done. And in the middle of our trial and in the midst of it all, God sends this technology to you.
Yeah.
So what a blessing it is.
It's amazing that you really do think you're kind of at the end, and you're not. God just opens another door or another window or just a ray of light. And I'm just very, very grateful.
I wanted to thank you for making the commitment to yourself, because that's what you're doing when you're using this wellness technology. You want to get better. Who doesn't want to feel healthy or have more energy, better sleep, all those good benefits of this amazing technology? Of course we all do. So yeah, making that commitment for yourself is huge. So I just want to give you such a big hug right now, and just tell you that we're continuing to pray for you. And I cannot wait to see what the Lord does in your life.
Thank you. Thank you for all the time and the commitment that everybody's invested in me. I really appreciate it. I want to learn all I can as fast as I can, but I'm retaining what I need to, I think.
We look forward to having you back on in 6 months to tell us all the new wonderful things that you're experiencing. So
I'll keep track so I can be accurate.
yes. Does anyone else have any questions? Well, do you have anything else you'd like to add, Vicki?
No, not particularly. Just really just understanding that just making that commitment if you're, trying to share the stem cell technology with other people, the X39, is just having them really make the commitment for themselves, because that's critical, and the continual use, over time. So, somebody that has health issues, it's going to take a little longer as far as somebody else that doesn't. And it's amazing. The benefits are endless, and I'm just so excited. Every day is an excitement for me. So
And I would say too, when I was in a wheelchair, one of my kids had to carry the wheelchair up 15 steps, run back down, get me, and carry me up 15 steps. And if you've been in that kind of crippling, debilitating lifestyle, you really appreciate small improvements. Like for me to walk 20 minutes is a huge thing. And I think people need to realize, unless there was a traumatic accident, it's taken a while for your body to break down. So it's going to take a while for it to get better. But when you've been as low as I have, the smallest improvements are you really appreciate.
Yes, so much so. That's wonderful. Well, thank you all so much for being here tonight. And we just pray blessing over you and look forward to hopefully getting back together with you next week with another great testimonial. Have a great night, everyone.
Thank you. Thank you,
Thank you.
Sandy. Thank you,
Bye-bye.
Nikki.
Good night. God bless. Bye, Sister.
God bless
Nikki.
everyone.
Bye-bye.
Thank you,
Thank
Sandy.
you.
Thank you, Vicky.
Bye.
Thank you.
Thank you for
Mhm.
joining us. Oh, I gotta take.